So there's most people who injure ACL often do is a part of a sporting injury, and they would generally, if they must play sporting pitch and suddenly change of direction, and often it's not a contact injury, patients would suddenly change direction with the foot planted on the ground, and they may feel a pop in the knee, and so often the knee will swell up immediately after that, and the patient will struggle to put weight. And that often is typical of ACL injuries, swelling and feeling a pop after twisting injury. There are, but confirming diagnosis, of course, a big part is assessment, which is what the clinician is required to do. And it's not just assessing ACL. ACL is part of a whole complex of the joint with multiple other structures inside the knee joint. And it's important for clinicians to assess other injuries along with ACL injury because that's what affects the final outcome. And all of these have to be addressed together in composite to give the best outcome to the patient. So ACL tear is, of course, history is important. So swelling after injury is a key thing. But then the next bit is clinical assessment, and where we assess the whole other injuries which could be associated with the ACL joint and can affect the final outcome. And then most people will need an MRI scan to confirm the diagnosis. But the scan can sometimes be wrong. It has to be assessed or read in conjunction with clinical assessment because scan is done with patient say lying on a couch and there's no stress on the joint, which you would put when you do your sports. So the good clinical assessment is an important part, and both assessment and a scan work together to give a final diagnosis. Okay, so not everybody with ACL injury needs surgery. The choice of treatment depends on what sort of work or lifestyle and sporting aspirations you may have. So somebody who has who may just do gym work or not doing any sports which involve twisting activities can actually do well without an ACL reconstruction surgery. But if your sports involve activities with a lot of twisting, then some surgery may give better outcome, especially to prevent further damage to the joint. What can happen is that if your ACL is missing, as you twist and you knee kind of foot is on the ground and you twist, the joint can move out of place and the knee may feel like it's giving way. And it also traps other structures called meniscus. They're like a cushioning cartilage, and you can get secondary damage to that. So one role of ACL reconstruction, besides of course getting you back to on playing field, is to prevent secondary damage. But straight line activities like cycling or often gym work, you can deal with just rehab and potentially live without ACL. Occasionally, the decision is taken by associated injuries because they can dictate. So if you have a bad meniscus tear which requires repair, then you're better off having surgery rather than just rehab. So associated injury can dictate a decision, and but pure ACLs, you can choose rehab or surgery based on your life aspirations and sporting activities. So surgery for ACL reconstruction is one part of the whole rehab and recovery package. And we work with you, of course, surgery, we do the surgery, but the recovery after surgery is really important. And that's something we work really close with the patient. When we do surgery, essentially the surgery involves putting this new ligament, new ACL for you. And the key thing is the choice of the graft, what we use, and it's usually a graft which is a tissue taken from your own body to make the new ACL. And in my practice, I choose a graft based on individual patient's needs, and it's bespoke to the patient. So it's not the same technique for everybody I use. We can use either hamstring graft, quadriceps graft, or kneecap tendon graft, and they all have different advantages and disadvantages. And this often gets discussed with patient, and based on that, we make a plan with patient. But other important thing is addressing associated injuries. So this tissue called meniscus, that often needs repair, and often there's damage to the side ligaments, which may need work. So all of that gets taken into consideration because the joint works together, a composite when everything is, what we want is to restore the anatomy back to normal to get the best outcome for the patient. So recovery after ACL surgery, there are different stages of that, and it may depend on associated injuries. So if the meniscus is repaired or other ligaments are needs work at the same time as ACL reconstruction, then rehab after surgery may be a bit slow. But purely ACL reconstruction, if we do, we'll get you walking straight away. Crutches is only for short period, and then you'll go through a rehab, and there are different stages of rehab. And as you progress through rehab, which we do what's called a criteria-based rehab. So that means once you reach a particular stage, then we progress you to the next stage. And you can anticipate about 6 weeks or so, you may start some gentle jogging and then start gym work. But if you're doing a twisting sports, we would recommend waiting up to a year to go back to twisting sports as a competitive thing. But around 9 month mark, you start training for your sport so that you can get your muscle memory back and get the muscle conditioning so that as when you return back to the pitch, you can be confident that your knee will be stable for you. Key thing is prevent further injury. That's the most important thing. And so rehab is a big part. And as I said, we work very closely with the physio team and to get you back on the playing field.